I now move to the short debate, and I call on James Evans to speak to the topic that he has chosen. James.
Deputy Presiding Officer, I'd like to give a minute of my time to Russell George, Sam Rowlands, Gareth Davis and the one and only Janet Finch-Saunders. The future of healthcare in rural Wales is under serious strain. In Brecon and Radnorshire, we face a unique set of challenges due to our sparsely populated areas, which has limited access to hospitals and emergency services. Most residents are forced to travel outside the county to receive essential care. This issue is especially concerning given our ageing population in Powys, where nearly 28% of the population are aged 65 or older, much higher than the national average. This figure is projected to skyrocket, with over 65s reaching 47,000 by 2036. Despite these increasing needs, Powys Teaching Health Board struggles under a £23 million budget deficit, a clear indication of financial mismanagement. While some positive steps have been made, such as advancements in stroke rehabilitation and mobile dental units, all these are to be welcome. They are consistently undermined by significant cuts to our essential services, which are always on the front line. Most concerning are the cuts to MIU opening hours across rural Wales and the downgrading of Krieg Ward in Brecon, which cared for dementia patients. Knighton Hospital in the north of my constituency has been reduced to a small respite unit, further diminishing the scope of the care we can provide locally within our cottage hospitals in rural Wales. The downgrading of these services aren't limited to Powys alone. Recently, Aneurin and Bevan Health Board announced the closure and downgrading of wards, meaning a loss of nearly 15 beds at a minimum. Our district general hospitals in Merthyr, Hereford, which is across the border, Swansea and the Grange, are frequently at capacity and on red alerts. Our maternity services in Bronglais can't accept any more patients. These are not isolated cases, but signs of a system, our NHS here in Wales, which is buckling under pressure. I do applaud colleagues from all across the political spectrum in this chamber who have spoken out cuts to the NHS in their own communities, as we're all facing the same challenges right the way across Wales. For non-acute care, the situation is even more fragmented. It's unacceptable that elderly residents in Abercrave must travel as far as Telford for eye appointments because of service-level agreements that rural health boards strike across the country, even though a closer hospital in Swansea could handle that treatment. It simply isn't good enough. Similarly, patients from rural Wales find themselves driving to Shrewsbury for orthodontic care for their children, despite these services being available much closer within Wales. These examples show the breakdown in coordination between health boards, leaving patients stranded in a web of bureaucracy and needless travel. And more often than not, as an MS and other MSs who represent rural Wales, we are contacted to pick up the pieces. Our health boards may be under budgetary pressures, but there is no excuse for mismanagement. That disproportionately impacts our frontline services. Efficiencies could be found in the NHS by streamlining management, improving organisation, and rethinking our approach to healthcare delivery. Time and time again, we hear the Health Secretary that they won't intervene in local decisions. Yet, this isn't just a local decision, this is a national problem. We still lack across Wales a unified IT system across health boards, and waiting lists in Wales are out of control. We need strong oversight from the Minister, and it's time to shake up the system to root out waste and prioritise the health of our people. I know the previous Health Secretary did some work into looking into the organisation and accountability of health boards across Wales. And I'd be very interested to hear from the Cabinet Secretary a little bit about that and how he can actually hold health boards more to account. What we do see, though, is top-level management positions across health boards. They keep getting advertised. Yet I hear countless stories, I'm sure as others do, of roles that one person used to handle now being expanded into multiple positions with no increases in efficiency. This must change. The bureaucracy grows and grows as frontline services are cut. The critical role of GP practices in rural communities cannot be overstated. We had a good debate in here earlier on the future of our GP practices. They are our front line. They are the stopgap between critical services and community services. But many of them feel they're consistently fighting against health boards just to provide basic care because they cannot get contracts arranged with health boards. Their innovative ideas and solutions to improve service areas are often ignored. They're presented to health boards across rural Wales, and the health boards don't want to listen to them. And I'd be interested to hear as well from the Minister how actually our GPs can feed more into the process and directly correspond with the Minister to make sure that their decisions and their ideas are being heard by government. If we are serious about rural healthcare, we do need to empower our GPs and give them the tools to manage their practices efficiently. Dementia care is yet another issue that requires immediate attention. In rural Powys, only 40% of those living with dementia have received a formal diagnosis. That's shocking, meaning more than half are without essential support and treatment. And without that diagnosis, they can't get the changes and adaptations they need to stay in their homes for longer. With an ageing population, this lack of access to diagnostic resource is alarming. We must do better for those individuals, ensuring that every person, regardless of where they live, has access to timely, quality healthcare. The people of rural Wales deserve better. Our communities are being neglected by a system that has lost sight of what truly matters and more focuses on urban areas. We need a healthcare system that serves its people and not one that forces elderly residents into arduous journeys and ignores the hard work of our GPs and other health professionals. The NHS is not a sacred cow. It should not be immune from change. And time again, we see governments not willing to grasp it by the nettle and actually deliver the change that's needed. Because governments worry about the political backlash of changing the NHS, of driving efficiency and making it serve the people of rural Wales and the whole of Wales better. And I implore the Welsh Government, forget the ballot box, think about the people that the changes could actually make to get them seen in appointments, get operations done and make sure the system works better. The future of rural healthcare in Wales depends on action and accountability and a commitment to making real changes to the people who need it the most. It's time to prioritise frontline services, invest in our GPs, demand the joined-up approach that will deliver the healthcare our communities deserve and deliver that NHS that we all need for the future. Diolch.